So I just wanted to first talk about what a trauma bond is and why it is so hard to break out of. Okay. So basically, when you are in a trauma bond with somebody, that means you're in a relationship with somebody that has intermittent hot and cold. Okay. Intermittent love and hate towards you. So if this is done in childhood, this would be like a child with a parent that maybe teaches conditional love. They love you when you're doing something right, but the second you're not, then, it's like they're flipping all the time. Or a parent that's always angry, that blames you for their emotions. Like they make you feel responsible for how they're feeling. And so what happens is the child, because they're in this environment where the person that's so angry at them is also responsible for their survival, the child in its trauma response kicks on to try to ensure its survival by doing or being whatever that parent needs so that their anger can subside and the child can feel a measure of safety. So that being said, let's dive in. For those that don't know me, my name is Michelle. I'm a life and relationship coach, and I'm also the founder of the Thriver School of Transformation, which is a monthly membership where we meet together live on Zoom, and we work through the side effects of narcissistic abuse, childhood trauma, and complex PTSD together. So if you're interested in something like that, check out the link here. So I just want to kind of break it down, what it does in the brain. Okay. And they discovered the effects of the damages of the trauma bond when they watched how it affected mice. Okay. Just bear with me for a second. So what they did was, in this study, they put mice in a container, and there was a lever where every time the mice would press that lever, they would get a treat. Well, they learned pretty fast that they would get a treat every time they pushed it. So they would push it all the time, right? When they removed the treat from that mechanism, where the mice could still hit the button, but they would not get a treat. In other words, no matter how often they hit it, they no longer got a treat. What they noticed was the mice would quickly learn and not even bother to hit that button. So they tried something else to see what would happen if they sometimes gave a treat and sometimes didn't. In other words, intermittent reinforcement, right? What they learned was really surprising. The mice, because of the inconsistency of never knowing when they would get a treat, they would keep trying and trying and trying until they got that treat. Sometimes even not even taking care of their needs, not eating, not doing anything, but being like addicted to hitting that button and getting that treat. And so upon further studies, what they realized was that when the brain gets that reward, when the brain has a behavior that is reinforced, it'll give you a dose of dopamine. Dopamine feels good. It's a feel-good hormone. It's also a very addictive hormone. Okay, so what happens in the brain is the brain starts noticing a pattern. Our subconscious learns with patterns. What they noticed with children is that the hormones that would go through the child when the parent was angry, those are stress hormones. They're very uncomfortable. They don't feel good. And so the child would do everything and anything to try to reestablish the bond with their parent. So that's when the child tries harder, tries to be better, searches for the secret formula to make mom or dad happy, right? And they're trying and trying and trying. And then suddenly the parent either decides to give a tiny bit, because that's what narcissists do, right? They'll give what we call a crumb of love, a crumb of attention. But when you've gotten nothing and you suddenly get a crumb, it feels good. And that gives the brain that dose of dopamine when that happens. And the brain, just like in the case with the mice, gets addicted to that. So depending on the trauma response of the child, depending on the personality of the child, that child will develop coping skills that are designed to try to get that parent to give that love and acceptance, or that crumb of love. Okay. So if their trauma response is to fawn, that means they become very codependent, where they will sacrifice self all the time, just to make that parent happy. if their response was freeze, well, then if they were doing something they love and the parent doesn't like it, they'll just stop. They'll stop doing the things, even though they love them, if it makes that parent happy. If their trauma response was flight, they will just do, be, try harder, 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 trying to be busier, trying to do more, trying to prove. And sometimes in childhood, they'll be flipping from all of those, trying to find their parents' acceptance. Okay, that's a trauma bond that's super hard to break out of, especially considering the fact that in childhood, that parent is also involved in your survival. Okay, so that's what happens. Now, why am I saying that this is going to affect adulthood? So I'm just going to throw out two things that I see a lot of, and I'd be curious to your views. Let me know in the comment section if you have seen or experienced either one of these scenarios. Okay, and if there's one that I don't mention, I'd love to hear it in the comment section as well. So the first scenario that I hear is that, or I see a lot of, is that a child might leave their home and they leave that environment. And let's say for some reason, they're able to kind of compartmentalize what happened. So they start living their life as their authentic self. They start living and having healthy relationships. They start creating an amazing life. And then they wind up in a situation. It could be with a friend, it could be with a work relationship, it could be with a significant other that has a similar dynamic as their parent, okay, that hot and cold. And because their nervous system, their subconscious mind, because the trauma is still there, right? They may have compartmentalized it, but it's still there. So because of that, their nervous system sees a similarity in something that it deems familiar. Now, you are not your nervous system, but your nervous system is very intertwined or interlinked with your unconscious. And in your unconscious, there was a pattern. Anyone hot and cold, you had to try harder. You had to do more. You had to be better. And if that was dormant for a while, that's fine. But somebody in your present life as an adult can open up that door and you will feel this desire to try to please an unpleasable person, try to make it work with somebody that is obviously trying to hurt you. And logically, you might be thinking, what is wrong with me? Like, I know that I don't want this. Why is my body pushing me towards this? Okay, and that's because if you had a trauma bond in childhood, but there are still core wounds as a result, a person can open that door. A similar personality to the person in your childhood that was abusive can open that door, and you'll start coming from that place in childhood where you feel your body pushing you to be better, to make peace, to recreate that circumstance and possibly get it right this time. Okay, so that's something that happens, that I've seen happen a lot. But even more so that I've seen happen is some people never get to compartmentalize their trauma. So maybe they went from their whole childhood being in a trauma bond with their parents, and maybe they wound up in high school in a romantic relationship with somebody very similar, because when you grow up that way, that's your normal, and that's what you're going to be attracted to for most of the time. So this person goes and now they're recreating the dynamics of their childhood in their adult life. Now they're in a trauma bond with somebody in an adult relationship, right? In a romantic relationship. And that can go on from person to person, from one toxic person to another. And sometimes they only get worse. They start out as like an overt narcissist. Then you learn about that and you go and you realize that now you're with a covert narcissist. Then you get out of that and now you're with a psychopath. It tends to get worse and worse because you're learning about it on a surface level. Narcissism, narcissistic abuse, narcissistic traits, and all of that is important. But in order to break out of the pattern, It really involves uprooting the core wounds that were established in you, in your subconscious mind, in childhood with the first people that created that trauma bond in you. If you don't change the beliefs and the strategies that your child mind developed at that time, you will find yourself attracted or feeling more comfortable in those kinds of relationships. Now, recently I was talking to a client who's about 20, 21, which I love all these young people that are getting it at such a young age. It's so awesome. But she was telling me, she was saying, Michelle, I noticed that with my friends and boyfriends, that if somebody is toxic, like she knows now what toxic behavior is, she can see it. She said, I can tell, like, when they're toxic, I feel that I try harder, that I show up with more, like it, I feel something inside of me kick on. And what she's feeling kick on is her nervous system and unconscious pattern of the trauma bond, of knowing, of recognizing it, and then showing up in the pattern that was accustomed, or the pattern that she was in for a long time. Until we get to the core wounds, you can be susceptible. You can be susceptible to relationships, work relationships, romantic relationships that are going to not be healthy. Okay, so my whole point in this is that it's vital to not just leave a toxic relationship, but it's also vital to get to the root of what feeds the trauma bond. And there's a lot of tips that are helpful when it comes to the trauma bond, such as learning how to live in the present, right? Teaching your brain how to stay with the moment, because the brain wants to think of the reward it's going to get at that moment that you get that crumb of love. It's going to want to put you back in the past and remind you of the one tiny little thing they did. And so you're kind of training your brain to be in the present. Yes, that is completely 100% needed. But once you do that, you really have to go into the subconscious programs and figure out what ones can get kicked on again, what ones are still there that could cause you to tolerate or allow relationships that are going to treat you in ways that you don't deserve. That's the real healing. It's about uprooting, upgrading, overturning those old limiting beliefs that were put into you because of the abuse and the trauma bond, and having a different set of beliefs from the inside. It's not about controlling our environment on the outside. It's about fixing, I don't even want to say fixing, I don't like that word, allowing yourself, teaching yourself how to uproot what was put into you because of the abuse so that you can be who you really are. And that takes a little bit of time. It's not easy. If anyone is struggling with that and you're watching videos, but you still feel like you're just spinning in circles and staying in the same place, make sure you check out the Thriver School of Transformation, because that's what we do. We work through the side effects, we work through the symptoms so that we're not living life stuck in symptom management for the rest of our life, but so that we can get to those core wounds, overturn them, and live life as the person we really are instead of who the trauma turned us into. So if you're struggling and you feel like you can benefit from the weekly assistance, make sure you check us out.